Hey everybody, we are back with the next part to our Baby Friendly Initiative Primer. Just for anybody who needs a little more education before they might possibly get interviewed by a baby friendly visitor. I have the same guest here plus an extra. We have Dr. Jacqueline Calvo here. This is Megan Brady. She is on rotation here. She's a PA student slash baby friendly initiative question asker lady. She's very good at this, and I have Dr. Shatowska here to back me up in the background. So the interaction you will watch is between our patient, Jackie, and our breastfeeding lady who's coming to visit and do the quiz on the patient. Jackie is going to play the role of a postpartum patient, and this is what they'll do. They'll just come up, find a patient, and ask any of your patients. So really the important part is making sure that you get this education out to your patients prior to them coming into the hospital and having a baby, because they will be asked these questions, and we just want them to show, this is our time to show off. And so we want to show that you've actually done the education prenatally, and the patients are well informed about breastfeeding. So, you ready?
Ready.
Let's do it.
Hi there, how are you today?
I'm good, how are you?
I'm doing well. My name's Megan. I'm the Baby Friendly Initiative lady that's going to ask you questions today.
Nice to meet you.
Nice to meet you also. So first question, during your pregnancy, did anyone at your doctor or midwife's office prenatal breastfeeding class, WIC or OB clinic, discuss breastfeeding with you?
Yep.
Yes. And how often was it discussed?
Probably 3 or 4 times in my prenatal visits.
Great, great. And where did you go for your prenatal visits? Where was this discussion? Hospital, prenatal clinic? Were you
private office.
Private office, okay. So it could be any setting. And for the following, the rest of the questions, they pertain to any setting for prenatal visits.
Okay, and so what are they looking for as an answer here? So for that one question, they just want to confirm that breastfeeding has been discussed at all. And I think every patient will probably answer that one appropriately. Hopefully everybody's bringing up breastfeeding at least one time in the prenatal course.
So the only wrong answer to this would be no. No one told me about it. Okay, next question. During your pregnancy, did anyone at any where you received your prenatal care, in your case at your private office, did you have written materials on breastfeeding?
That's okay. I don't think a lot of people have them. And if you have them before April 1st or 2nd, please give them out. And if you need some, we ordered a bunch from March of Dimes. There's this great booklet. I have it in the family tree room. And it is like how to, but even if you can give patients websites to look at, they're going to answer honestly, and we would like them to say, yes, they gave me something. So if you don't have anything, it might be a good time to kind of start doing that for the patients who are about to have babies just in time. But
there are too many trophoblasts going around in your brain to remember that sort of thing.
Sometimes we do discuss things with patients, and they still say, no, but he told me that.
Exactly.
So just playing devil's advocate, that does happen.
Yeah, and again, if they are postpartum and they're not thinking, they might just say, I don't remember it. So
I got handed some stuff that I didn't read. So
well, and that might happen too. So this is just, again, try to remember, if you can give resources that the patients can educate themselves as much as they can before coming in, it can only be helpful for them. So they are going to be asking that question.
And if you had received something, or maybe you did, the follow-up question is, what did you receive? So what type of information did you get, just to note. The next question is, did anyone at the doctor's office discuss the benefits of breastfeeding with you?
I think they would have if they didn't know who I was.
That's
good answer.
That's great. And I think they may run into one of our residents having a baby who might say the same thing. So I think the take-home point there is, even as doctors, we don't know everything about this, and it would be tragic to not educate our colleagues on this. I know with my first baby, I was completely clueless about everything, and so Jackie, we knew, was studying about this anyway. So I don't know if I would have even told her anything, but that's bad. I should. But yeah, so make sure that you've at least, if you don't have time in your office and everybody's very busy, have somebody assigned to at least give information or give resources and try to educate the patients.
And we'll ask the patient to name benefits that they were taught about breastfeeding. So, and they're really looking for specifics about antibodies, better nutrition, or I'm sorry, specifics like reduced ear infections, gastroenteritis, more so than non-specific things like, oh, it's just better. So
Yeah.
they want
examples.
specifics,
They want
yes.
specific examples. So if you had to give some examples as a patient, benefits of breastfeeding.
Weight loss, maternal weight loss.
Yeah.
Just the overall bonding's
Yeah.
pretty important. That you have decreased risk of allergies in the baby in the future. The babies, like you said, have fewer ear infections, fewer general infections. If the mom gets sick with something, the baby tends to not get as sick as they would otherwise.
Great.
Perfect, perfect. And those are good specific examples. I don't think they want just weight loss, and I think that's, isn't that in one of their examples of not specific enough? I want to say they.
Right. Mm-hmm.
I don't know why, I think that's my favorite
That's-
one,
yeah.
but whatever, it's
Sounds
baby
great.
friendly. Anyway, moving on.
Not mom.
Okay. Now, did anyone at your prenatal visits discuss the importance of spending some time in skin to skin with your baby after you deliver?
Yeah.
And can you remember what was said about skin to skin time?
That is, I mean, I know what I know.
Well, okay, what do you know?
You're the patient.
You have increased exclusive breastfeeding rates at like 3 and 6 months with breastfeeding and at discharge from the hospital if you do skin to skin within the first hour.
Great.
Feel free to help out. Can you think of any skin-to-skin benefits?
It definitely helps with the latch. Well, it helps baby initiate the latch.
Uh-huh.
Yeah.
Mhm.
Right away.
And they tend to not have as many problems with their temperature and their blood sugar.
Right.
Perfect.
Right. So
Ding,
calms
ding,
mom and
ding.
baby, regulates baby's vitals and glucose and
Mhm. And gets breastfeeding off to a good start.
Yep.
Great. Now, did anyone at your prenatal visits discuss the importance of having your baby stay in the room with you while you're in the hospital, the rooming in?
Yes.
Now, what do you remember about rooming in and the benefits of that?
Again, it's increased exclusive breastfeeding rates.
feel free to jump in.
Well, this is going back to the first phase of this
Mhm.
seminar, whatever this is. It helps with the demand, with the mom answering any the baby's demands for feeding, and it helps mom comfort baby as baby needs it.
Great.
Perfect. So, you really want the mom to learn the baby's hunger cues while she's
Yeah.
here in her postpartum stay. And so with the baby in the nursery, that's harder to do because they'll miss those cues and they only recognize the crying as a late sign of hunger versus, the rooting and the hands to mouth and the flexion extension, the tongue thrusting. So they can recognize these signs and really learn the baby. And the baby learns the mom better, so there's better bonding. And then, like you said, calming techniques. They learn to recognize when the crying is not for hunger, too. So,
Now, speaking of the demand feeding, did anyone during your prenatal visits discuss the importance of demand feeding with you?
On postpartum, yeah.
okay.
And what was said about it?
That whenever you're seeing those early hunger signs, you should put the baby to breast.
Great.
Perfect. So, the question is more geared towards prenatal care. And so while Jackie got the education, their emphasis is going to be on, is the patient receiving this education before they get to the hospital? So again, something to, if you're not doing already, try to start doing. It should be a habit that we all get into, and I think we could all do better at this. But, the more education these patients can get, the better, if they do choose to breastfeed.
I have a question. What if the patient that you approach with these questions actually has always planned on bottle feeding, and she had chosen to do formula feeding way from the beginning? Not that the patient will be resistant to hearing these things, but if you hear that as a physician and you've got a busy day and you're running around and you may not discuss all of these things, if the patient has already decided, and granted, it's not always an informed decision,
That's the key point right there. So, you just have to go that one step further, and I think they just want to make sure that patients are making that informed decision. So again, like in the part 1 video that we did, it's about informed consent. So we all think about how we give patients informed consent about C-sections, vacuums, blah, 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 any surgeries. This is the patient's decision, and Baby Friendly is not about forcing breastfeeding on anybody. It's about empowering women who want to breastfeed to be successful, because we have so many societal barriers in place that make it difficult, and all these expectations that make it difficult for a woman to meet those goals. So if the patient truly is like, it is not for me, I can't handle that, I know all about it, that's fine, as long as she truly knows, and this will kind of get to the bottom of that. But in your office, we want to get in the habit of not just asking, are you breast or bottle feeding? Great. You can say that, that's awesome. But if they are bottle feeding, you just want to do that one extra step of saying, is there any reason why you want to bottle feed? Just try to delve a little deeper into that. And what I found asking that question is a lot of people are like, well, I have to go back to work, and they're not aware of the laws in place to protect them if they really do want it. They're like, oh, people at home are going to be around, and so sometimes just a little counseling really makes them feel like, oh, maybe I can do this. And so, I think the expectation is just to go that one step further and ask that question.
Great. Now, during your prenatal visits, did anyone discuss with you the importance of positioning and attaching your baby properly for breastfeeding? We would hope the answer is yes, and if it is, what would you imagine that one would have educated you about?
I mean, you can go through the different holds and the fact that there's going to be more pain with an incorrect latch. So if you work on the latch, then it should be a more comfortable process for all those involved.
Great. Preventing sore nipples, ensuring that the baby gets enough breast milk.
Mm-hmm.
Awesome. Now, what about discussion of the importance of not giving your baby formula, milk, or water if you are breastfeeding? Was that covered?
Probably not.
Yeah, I don't know if we routinely bring that up either.
No.
But one more thing to be sure to educate your patients on. Well, this actually, used to be routine back in the day when we were all babies. The babies all got sugar water in the nursery, and times have changed. So I think one of the barriers we have are these patients are at home and their support systems are all, our parents who were taught this way, and we have to change that knowledge base. And so if the patients go home and they're educated by their parents that, oh, you need to put rice cereal in the formula so the baby will sleep all night, newborn baby, we have to make sure that the patients are educated appropriately. And in the same way, if you're exclusively breastfeeding, that is enough. You don't need to give extra water. You don't need to give any supplements as long as the baby is healthy and doing fine and your pediatrician hasn't identified any issues. So, it's a quick sentence, and you can divide it up into the last few prenatal visits of, oh, I see you're planning on breastfeeding, just make sure when you're breastfeeding, you really don't need to give anything else, that's enough. And the water thing is a common question, so.
Except for vitamin D drops at one.
That's true. Vitamin D drops I was terrible about, but they say you're supposed to do that. I hated those things, but you're supposed
my guy
to.
loves them.
Yeah.
Now, this is pertinent for both of you, since you're back at work and have babies at home. Prior to delivering, did anyone teach you how to make a bottle of your breast milk?
Or formula. I think that
was it formula? Oh, yeah, it is.
Yeah. Have you
Okay.
ever been taught in your prenatal course how to make a bottle of formula? And for women who are planning on breastfeeding.
I
So
just
this is
assumed
geared
it would be
towards-
about breastfeeding,
Yeah.
so my bad.
No.
No.
That's the right answer. It's a trick question. So I asked Sharon and Patty about this. I'm like, oh my God, are we supposed to be teaching people how to make formula bottles? No, you are not supposed to be teaching that. So if anybody answers yes, we got problems. So I don't think anybody around here, even goes close to that kind of education. But if you're teaching,
Instructions are written down somewhere.
yeah. Well, and it's a postpartum thing. So obviously, Baby Friendly wants you to feed your baby appropriately, however you choose to feed your baby. But this is done on the postpartum floor. They just don't want anybody in the office setting or at WIC or wherever telling a woman who says, I want to breastfeed, be like, well, just in case, let me show you how to make a bottle of formula, because that's kind of not a good idea. So they will learn that in the postpartum course, and so as long as you answer that one honestly, you can't go wrong.
And of note, if you had said yes, if I phrased the question bottle of formula, I would then ask who showed you, where did this take place, and was it part of a group or class?
So we can arrest
they will find you.
So that concludes our baby-friendly tutorial. If you have any questions, you know where to find me. I'm here. You can find all of us here in the next few weeks. I don't know if Megan's still here in the next few weeks.
Couple more weeks here.
And Sharon and Patty, their phone number is extension 5226. They welcome any questions. They welcome person-to-person interviews. If you want 15 minutes to sit down so they can go through this again, we really want everybody on the same page with the education. Feel free to email me, andrea.joyner, joyner@hhchealth.org, or just call me. I'm not going to give my phone number in case this goes viral. So
I hope it does.